we are continuing with radiation therapy. So in the previous class we have dealt with what is radiation therapy, what is different types of radiation, etc., right? So in this class we are dealing with ionizing radiations and which all are the side effects of radiation. So the ionizing radiation, that is two types: electromagnetic radiations and particulate radiations. Electromagnetic radiations mainly indirect ionization. The particulate radiation, that is direct ionization. So in indirect ionization it includes two rays, that is X-rays and gamma rays. X-rays, that is extranuclear, and gamma rays are the intranuclear. So X-rays, it is produced in an electrical devices that accelerates electron to a high energy and then stops them abruptly in a target. So this is the working of linear accelerator. So here electron beam is used to produce high energy X-rays. Then gamma rays. Gamma rays are the intranuclear. Here it is emitted by radioactive isotopes. So here we are using radioisotopes, for example cobalt 60. Excess energy is given off an unstable nucleus which breaks up and decays in its effort to reach stable form. So when a radioisotope is present, it will emit energy always, and then it will be stable form. It decays its energy and it becomes a stable form. So that's why the gamma rays are used for the radiation. Then another form of radiations we are used is direct ionization. Here we are using electrons, protons, alpha particles, neutrons, heavy charged particles. And now we can see what is the benefits of radiation therapy. Radiation therapy has high success rate and it is non-invasive in nature. There is no surgeries needed. There is no chemotherapeutic measures we are used. So it is a non-invasive and targeted treatment. So we can give targeted treatment in the radiation. Then improves quality of life. The radiation therapy that will improve the quality of life. The pain will be reduced, the size of the tumor will be reduced. So it ultimately it improves the quality of the life of patient. Then there is some risk for radiation therapy, that is side effects. There are some side effects for radiation therapy, and it damages the healthy tissue. No, not only damages the healthy tissue, it affects the rapidly dividing cells. Then secondary cancers, there is a risk of secondary cancer. Then emotional impact in case of alopecia, or in case of side effects, there is lot of emotional impact will be occurs from the part of patient. So there are some risk like that. Main risk is the secondary cancer. The radiation therapy always give in multiple daily fractions, treated for 1 to 6 weeks, usually for 5 days a week. So different multiple fraction is used in radiation therapy in order to repair the normal cells. Okay, we have to repair the normal cells, otherwise there will be lethal damage to the normal cells if there is no break in the, or there is no fractionation. There will be high energy will be there will be high X-ray will be enter into our body, so it may cause serious problem. That's why we will be multiple daily fractionation will be done for the radiation therapy. It will save the life of the patient. So usually we are treated for 1 to 6 weeks, and usually 5 days will be radiation therapy and 2 days off. There are some contraindications to radiation therapy, that is severe anemia, poor general health, sepsis, pregnancy, presence of fibroid in uterus, tubo-ovarian masses, uterovaginal prolapse, fistulas, radio-resistant tumors. In these conditions, we are not doing radiation therapy. So that is severe anemia, poor general health, sepsis, pregnancy, then presence of fibroid uterus, tubo-ovarian masses, vaginal prolapse and fistulas and radio-resistant tumors. All these conditions we are not doing radiation therapy. Now we can see which all are the factors influencing degree and occurrence of side effects due to radiation therapy. So which body area or which site is irradiated or which site is giving radiation therapy. So that is very important for the side effects. Okay. So based on the area of radiation, based on that there will be side effects. Then dosage, the accuracy or the if the person is receiving high dosage, there definitely there will be more side effects. Then extent of body area is treated. So if the tumor is very large or if the body area is large, so the multiple injury is common in radiation therapy. If the tumor size is low, means there is less will be the side effects. Then age of client. The radiation therapy, it affects the age of client. If the person is old age, there is high risk for radiation. Then general health of the patient. Poor general health patient, we will not give radiation therapy. So adequate healthy patient or adequate health is needed for radiation therapy. Then previous surgeries and chemotherapy, we also consider the previous surgeries and chemotherapy while giving radiation. Next one, radiosensitivity of tissue or organ treated. So some tumors are radio resistant, so radiation resistant. So at that time we are not giving radiation, because if we are giving radiation also there is no that much improvement. So we are assessing the radiosensitivity of the tumors. Okay, so these are the factors that affect the radiation therapy and also affects the side effects. 5 R's of radiobiology. It includes repair, repopulation, reoxygenation, intrinsic radiosensitivity, redistribution. Repair means here the normal cells have the ability to repair the DNA damage. The tumor cells, it cannot repair themselves. So in another radiotherapy, we knew that radiation therapy, it will be fractionated. Okay, so in one fractionation dose there will be DNA damage, and next fractionation dose or next radiation therapy, the repair may be it will not be possible and may leads to lethal damage. So the tumor cells will be destroyed and normal cells can be repaired if we are fractionating the dose. Next one, repopulation. Repopulation means when we are destroying the normal cells or tumor cells, there will be neogenesis. There will be blood supply and again the tumor will be grow. So that's why we are fractionating the dose. If there is delay in radiation therapy, the tumor will enlarge its size. That is known as repopulation. That's why fractionated dose is essential for radiation therapy. So in consecutive interval we are giving radiation therapy. So there will be repopulation will be there in radiation therapy, and the patient should be informed regarding the regarding this type of repopulation. Some may think that why this will be enlarged after radiation therapy. Okay, so that's why repopulation may occur after radiation therapy. That's why the radiation therapy will not be too delayed. Next one, reoxygenation. The reoxygenation is essential in case of radiation therapy. Hypoxic cells are resistant for radiation. So if the cells are reoxygenated, they are more prone to get radiosensitivity or radiation. So the reoxygenation is the reoxygenation that will helps to destroy the cancer cells. Next one, intrinsic radiosensitivity. uh, Based on the cells, okay, the variety of cells we have, based on the cells the radiosensitivity will be different. So the based on its metabolism, glycolysis, it affects the radiosensitivity. Some tumors, it will be radio resistant, and some cells are radio resistant. um, so that's why the sensitivity, radio sensitivity, that we have to consider while giving radiation therapy. Next one, redistribution. The cells will be, we knew that there is cell cycle, okay, G1, M0, M1, like that phase is there. So that based on the cell cycle, the uh, radiation effects will be vary. So redistribution of the cells based on the cell cycle is there. Okay, so that is regarding the 5 R's of radiobiology. You just understand there is 5 R's, that is repair, repopulation, reoxygenation, radiosensitivity, redistribution. The members of radiation therapy, it includes radiation oncologist, radiation oncology medical physicist, radiation therapist, medical dosimetrist, radiation oncology nurse, social worker, dietitian, physiotherapist, etc. Here, the radiation oncologist assess the patient condition and make a meeting or discussion with the radiation oncology physicist, medical physicist, and radiation therapist and dosimetrist. Based on the condition of the tumor, they make an individualized plan for each patient. And firstly, they will understand the size of the tumor, the length of the tumor, and based on that, they are making a concise plan for each patient. And the dosimetrist, the medical dosimetrist, he will be made plan for fractionation. Okay, accurate dose and fractionated doses he will be decide, and all the treatment plan will be supervised by the medical oncologist, radiation oncologist. And the radiation therapist, he will deliver the radiation therapy by the supervision of radiation oncologist, and also by the uh, treatment plan. Then a radiation oncology nurse, they are giving care for the patients. Then social worker and dietitian, they will take care of the patient in social aspects, and also in the nutritional aspects the dietitian will be take care. Then physiotherapist, they will take care, especially if there is abnormality occurs after the radiation therapy. So radiation therapy is a teamwork. Okay, firstly we will observe or identify the type of tumor. Then we are making a treatment plan, and we are considering the amount of radiation, which type of radiation therapy have to be used, and then we are fractionating the dose, and in between we are making a simulation. Okay, so that is with the help of CT scan, and here we are making a mold that will helps the person to what to say the stabilize the patient. Okay, the person, if we are moving, the radiation dose will be sent to another areas. Okay, so in order to immobilize the patient, we have to use the molding. So everything that will be prepared by this team, and finally we are giving the radiation therapy in fractionated dose. Side effects of radiation therapy include skin problems, fatigue. The skin problems and fatigue are very common with radiation therapy. Change in appetite, diarrhea, nausea, hair loss, coughing, swelling, blurring vision, headache, breathing difficulty and difficulty in swallowing. These are affected in which area the radiation therapy gives. So the common side effects, it includes the skin problems and fatigue. The skin problems, that is usually acute and chronic. The acute, that begins about 2 weeks after the treatment and resolve within next 3 to 4 weeks. The reactions mainly include erythema, dry desquamation and wet desquamation. Chronic, that may occur later, it include atrophy or pigmentation. Dry desquamation, that is very common after radiation therapy. It begins with the 7 to 10 days of treatment and starts with erythema. Firstly, when we are observing the radiation skin, it is the color will be in red color, or redness will be present. That's why it is erythema. Then it will starts to dry, then itching will be there, then it starts to peel, scaling will be there, flaking will be there, then peeling will be present. And this mainly due to partial loss of epidermal basal cell layer. Next one, wet desquamation. Wet desquamation, that results of complete destruction of the basal cell layer. There will be blisters, vesicles and serous oozing will be present. So the pain will be there and there may be high chance of infection, especially in the skin folding it may be present. The general care what we have to give for this patient is, we are using mild soap and soft clothes and we can't use tight clothes. Okay, so these little things we have to observe, and loose fitting clothes, that is very good for this patient. Then alopecia, that is hair loss. So here based on which area the radiation therapy occurs, based on that there will be hair loss, especially the head and neck radiation therapy, the alopecia will be present. It starts 2 weeks after the radiation therapy and it will be temporary, and the hair will be regrow after 3 to 6 months. Next one, mucositis. Mucositis is the inflammation of the oral mucosa, especially the GI tract will be affected. So oral mucositis means oral mucosal layer will be inflamed. So usually this can be seen in head and neck and oral oral cancers. All this a condition we can see this oral mucositis. And the main symptoms are soreness or burning mouth and difficulty in swallowing, sensation of lump in the throat, and redness, tenderness, ulceration will be present in the mouth. In case of mucositis, we have to use a soft toothbrush, and then we have to use the mouthwash. Okay, then a xerostomia means dryness of mouth. So it may be due to lack of secretion in the lack of secretion of saliva in the mouth. So salivary glands are very sensitive to radiation therapy. That's why there will be lack of saliva. And this treatment, or sorry, this xerostomia may usually temporary but may leads to permanent. Based on the area of receiving radiation therapy, blurred vision, headache and breathing problems will be occur. So usually breathing problems can be seen in lung cancer. Then headache and the blurry vision, that common in head and neck radiation therapy. Okay, so these all are the common side effects that can be seen after radiation therapy, and I hope you understood regarding the condition. Thank you.